Oh, so hot.
Ooh, is our lighting weird?
We look really dark.
Maybe it's the sun exposure.
See, that doesn't make any difference either.
Maybe it's farther.
Maybe it is.
This is the part of the video that we watch later, and we're like, damn it.
We're like,
should
man, we were
not-
making really
Yes.
stupid faces.
But it's not started yet.
Oh,
It
yeah.
started.
Yep, started.
Later, we're like, man, we were
I
making
already
really
said damn it, too.
said
Oh,
backwards.
man. So
Oh, no,
close
the
to
lighting's
not
not weird to other people.
Oh,
It's
okay.
just weird
It just
to
looks
us.
weird there. Okay. All right. Well, we're trying to figure things out. It's been 2 weeks. We don't know what we're doing anymore. All of
not a
our
clue.
technology expertise is out the window. So we will just wait a little bit while people gather in. Gather around, children. Just kidding. It's like a family reunion.
Deb.
We missed you guys last week.
Everybody's
Hi,
checking in. Hello, everybody.
All right. We expect lots and lots of participation and lots of questions. Easy questions, please. We're a little worn out. But we are ready anytime people want to start asking questions. We will
Yeah.
address them all. So
The more questions, the better.
yeah. Then you don't have to hear us just come up with random things to say, which we all know is a problem.
Right. But we do it.
But we do it. All right. I think we go ahead and get started.
I think so.
All right. Well, welcome everybody. Thank you so much for joining us tonight. I'm Jen Bacani McKinney, and I'm the Wilson County Health Officer.
And I'm Destiny Wheeler. I'm the Health Department Administrator.
All right. And we have made it through this. We decided this is our fourth month of all of this stuff. About 4 months ago, COVID came to Kansas. And so here we are. We're all still hanging out together and figuring out what we're doing, and we're doing it together. So we're already starting with some questions, which is great. We want people to ask plenty of questions. We are here, our only job is to help be a source of information for you guys. We will tell you what we know, we will tell you what we don't know, that we don't know something, not make up stuff that we don't know.
Yeah.
Usually, just kidding. But we will tell you everything that we know and share whatever information we have and find out any other answers that we might need to find out for you. So.
Yeah.
How about we start with statistics?
How about we do that? I just did the math before I walked out here. These numbers are from Monday. So the U.S. numbers, we are at 7 million and almost 66,000 cases in the United States, with 404,021 deaths as of Monday. And then in Kansas, we are at 10,650 cases as of Monday. That is an increase from Friday of 257. And deaths in Kansas is 236 as of yesterday, and that was an increase of 4 from Friday. And then here in Wilson County, of course, we've just had the one positive, and they have recovered, and we have 265 negative tests so far. So we're doing a great job of testing and a great job of not getting cases.
And we will talk about testing in just a little bit. We have a couple of questions already popping up, but we'll make sure to hit on that soon. Do we want to start with asymptomatic cases, or
Yeah,
wait on
sure.
that one?
So the World Health Organization, someone from there, made the statement that asymptomatic carriers are not necessarily spreading this this virus. So they came back and they said, we didn't mean that. So here's what I've read about it. And feel free to jump in.
yeah,
There's a
absolutely.
difference between asymptomatic and pre-symptomatic. Neither one is showing symptoms, but one, you can only tell if you're pre-symptomatic after you're tested and after you become symptomatic. So they're actually showing that those pre-symptomatic people who are not showing symptoms are actually very likely to spread the disease. They're actually have a lot of the virus in their droplets.
Their stuff. Yes, in their droplets.
In their droplets, yeah.
So, and we think it's important to differentiate between pre-symptomatic and asymptomatic because, again, you don't know who is asymptomatic unless they were tested and they never, in the course of, let's say, 2 weeks or whatever ever developed any symptoms, and you can only go back and look in hindsight, right? But pre-symptomatic people were going to develop symptoms, we just didn't know, but there was a chunk of time that they didn't have any symptoms and were able to spread. So we bring that up because it's we don't want people to be like, oh yeah, everybody has to be symptomatic then because the World Health Organization said that asymptomatic people don't spread it. No, we still are seeing spread when people don't know they have it and when people before they start showing symptoms. So which leads us to our big theme for tonight, which is going back to basics.
Yes,
Which
yes,
is?
back to basics. Stay home. If you do not feel good, wash your hands a lot, lots and lots of hand washing. Try not to touch your face. I know I just itched my nose earlier. It's amazing how
it's really hard.
aware you are of when you do something
Yes.
now. Like, I am very aware when I touch my face now, of course, as I'm doing it.
Yes,
but I'm
right.
like, oh no, I touched my face.
I mean, I stopped touching your face.
That's
I mean,
good.
that's good.
It's a start.
That was weird in the first place. So.
But those are the big important things to do right now because we are nearing our phase out period and we know that the virus is still circulating. We're still seeing about 100 cases a day in Kansas. So,
It's still here.
It's still here.
It's not less contagious. I mean, it
Right.
hasn't changed, but we're just we have the ability to test more. We have the healthcare personnel. We have the protective equipment that we need, so we're better equipped to fight the virus if we get the virus. So nothing about the virus has changed, but we just know how to deal with it a little bit better.
Mm-hmm. Yep, and that truly was the whole point of the flatten the curve.
Mm-hmm.
It was to give us time to get ahead of it, and
Yep.
and that's where we're at.
That's where we are, yeah.
Yeah.
So if you have a fever, if you have a sore throat, allergies are really, really bad right now. And you might be like, oh, it's just my allergies, which it probably is. Like, odds are good, it is probably your allergies. But if you do feel like you're sick, sore throat, runny nose, anything that could be not your usual, just stay home until we figure out, oh man, it was my allergies. I took some allergy medicine and it was fine, or you talk to your doctor and you worked all of that out. So just please don't take for granted that little tickle in your throat is nothing, because we are in allergy season and soon we'll be in cold and flu season. So we're going to have to be aware and continue on this trend of staying home when we're sick for the long haul until we get a vaccine, until we see that herd immunity, until we're able to combat this better.
Yeah, and I mean, from a public health standpoint, if you're sick, stay home.
Oh yeah,
I mean,
in general.
at any time of the year, in general.
Let's see.
How much I rub my nose. Yeah.
Yes.
Yeah, it is allergy season, and again,
Everybody's
my nose
rubbing.
is really itchy. But yeah, it is.
So we had a question about the pool opening. So the pools are open in Wilson County and most pools probably across the state. Everyone was super excited to get to the pools, which is great. We want people outdoors. We're finding that kind of is the safest place for people to be outdoors. So we are currently in phase 3, as Destiny said. We hope to be phased out in what we call phase out, what the state is calling phase out, as of Monday, June 15th. And we say we hope because hold on 1 second. We're going to close this while people walk by. Just a second.
Oh.
Little confidentiality. No big deal. Love you guys. Just a little hand picture. Yay. Okay. All right. See? Easy. Okay. So, see how good we are at this game. So we hope to be in phase out, meaning we hope to not see any big spikes. We hope to not see any problems with our ability to treat or prepare for all of this stuff. We don't foresee any of that. So as of Monday, that means that we no longer have mass gathering limitation. So right now, our mass gathering limitation is 90 people maximum in one setting. And so as of Monday, that means we don't have a mass gathering maximum. We also, I think that's really the biggest requirement is a mass gathering. In Wilson County, most things are open already, and so pretty much everything is open. No, I think everything's open. Classes, gyms, businesses, churches have always been open.
Yeah, everything's able to be open. Some places are kind of holding out and kind of making a different plan for how they're going to do things. I know the historical museum called me, and they do a lot of genealogy work with people, and they sit there and they were curious how the safest way to do that. And so people that aren't open yet, it's just because they're getting a plan in place in most cases.
But they're able to be open. So now, having said all of that, in phase out, the biggest thing to remember is that it is not a free-for-all still. It's still the time that we want to social distance whenever we can social distance. There was a question about masks, and Destiny and I have talked a lot about this. Nobody likes masks, so we just want to throw this out there. Some countries are better at wearing masks than we are, and we are just not used to wearing masks.
No, we're not.
That's just it. So we still believe that if you are unable to social distance, and the common places are going to be like at the grocery store or Walmart, where you're going to run into people and you're going to be passing by them, in close proximity, and you're probably going to talk to somebody while you're there. If you are going to be unable to social distance wherever you're going, then wear a mask. Very simple. If you are outdoors, if you're in your car, if you're doing whatever, you're walking, you're, going camping, don't wear a mask. It's fine. But that, just as a rule, a good rule of thumb is to wear a mask if you are going to be near people.
Yeah. So like one of the examples that I gave Jennifer earlier was I went and picked up food today at lunch, and I took my mask in with me because I didn't know how crowded it was going to be in there, and everyone was sitting down. So there was no one even close to 6 feet around me, so I just held onto my mask in case it got crowded.
Right.
So I was able to stay 6 feet away from people, and so that's why I just had it in my hand, because I'm like everyone else. I don't like wearing it either. It's not comfortable to me. It's quite warm, but if I'm going to be close to someone, I wear it. I got my hair cut. I don't know if you guys can tell. Wore a mask.
Good job. You look so pretty. I love your hair.
You.
I have not yet gotten my hair cut. Let's go with that. And then Kim, you mentioned how wearing masks in the community as well as in healthcare, and probably one of the most important things that Destiny and I have talked about is that our hospitals and clinics, they are really doing a great job of listening to the guidelines of the KDHE, Kansas Department of Health and Environment, Medicare, all the entities that are offering guidance, the CDC as well. And so we as a county aren't necessarily saying this is when you should wear a mask, this is when you shouldn't, but I will tell you they have had ongoing conversations really every week to say, okay, is it safe to have visitors in? How should we screen people? How long should we screen people? Just things like that, and keeping track of the PPE, the personal protective equipment that we have available. So they're constantly making sure that we're doing the right thing. Nobody's trying to do any overkill. We just want to keep everybody safe. And we know as we phase out, it's kind of this sense of like freedom. It's a little bit of like, what is that? What's the
Braveheart?
Braveheart, yes, right? Man, I was like Mel Gibson with the things
Getting
and the face and the disembowelment. Yes, it gets disemboweled so many times. So, we all kind of feel like, all right, we're out of the phases, but it's still phases, but keeping each other safe, throughout the whole thing. So in healthcare, we don't have the right answer for that either, but we are going to continue. I know here at Fredonia Regional Hospital, we're going to continue screening people and wearing masks throughout June at least, and just kind of see how things go, and we're playing it by ear. So, the cannons, I don't know if you guys are going somewhere, but Shelly and Meg asked about hotels and motels and if they're safe. Where are you going, ladies? Anywhere cool? So I would say yes. I believe that all the places that are open, such as hotels, restaurants, gyms, churches, all of those, everybody is really taking all of this seriously. So I would say that hotels and motels tend to be safe. You're in your own room, for the most part. If they're properly cleaning, that's really what we need.
I would stay at a reputable hotel.
Yes.
If it's really dirty, I wouldn't stay there.
Don't go there.
But that's kind of a general. It makes sense. Maybe they're going somewhere. but yeah, I would stay in a motel at this point.
Yeah.
There's a question about long-term care and when they will begin to kind of open up a little bit, let visitors in. this is getting a lot of discussion right now because we know that that's our most vulnerable population, and we do want to keep them safe. I'm sorry, but we also want to take care of their mental health, which we also know is really important. It's important for them to see their families. Discussions are happening about that. KDADS, which is the Kansas Department of Aging and Disability Services. Thank you. And KDHE are kind of putting together maybe some guidance for long-term care homes. They would fall underneath the county's plan, but our county has deferred that to the actual facility itself. So I know that we've had conversations. I don't have a full out answer yet, but I know that they're working on it, and they really are working on it, and they really understand that the residents want to see their families, and they really understand that the residents are at high risk. So they're really it's a balancing act there that
they're reaching out to us, and not that we're necessarily like the experts on this. We are also, while we're the public health side of things, we are also the voice of all of you guys saying, hey, we see our family members and they're hurting because they haven't seen their family, but they hear that too. So hopefully as soon as possible and as safely as possible, we will get visitors back into the long-term care facilities, and we can't say enough how impressed we are with the Wilson County long-term care facilities, both assisted living and the nursing home, and I just think their communication has been really great, and their staff has been really great.
Yes, so. Absolutely.
All right. Let's talk about the no-tell motel. Oh my goodness, I just touched my nose. Oh man. So let's talk about testing for just a second. So we talked about this a couple of weeks ago, but just to kind of bring everybody up to speed again, and this is in the context of Wilson County, but it really is general information for testing around the country and really around the world. Right now, we have in Wilson County on-site testing where we can do PCR testing, which is our gold standard. That's they're all swabs, right? The swab, the one. It's like from far away.
Yeah, you gotta go.
Like a sword swallower. So that's the PCR testing, and that is where basically they use the DNA, RNA to figure out if we have the COVID-19 virus present, and that has a really high sensitivity, meaning that if it is positive, it really is going to be positive. So we do have some false negatives, but it's still a very accurate test. Then we also have what we call antigen testing, and that's more similar to like rapid flu, rapid strep, the little swabby swab here and that kind of thing. Still into the nose like that, but it's a little bit quicker. It's a little bit cheaper, and just because we know finances are a thing for people right now, so we don't want people to not get tested because they don't have the money to get tested. Like we'll work with people. So it's a quicker test. We usually get the results in about 15 to 20 minutes, but its sensitivity is a little lower, 80 to 85%. And but then if it is positive, it is very likely to be positive. It does again have some false negatives, but that is an option too. And so we are very fortunate in Wilson County to be able to pretty much know if you have COVID-19 within an hour, maybe 2 hours. We've only we only have, let's go with that one, verb conjugation. Gotten. We only have a couple of machines that can run these tests, and so if you have multiple tests lined up, then there might be like a waiting line. You picture the little swabs just waiting in line patiently, taking a number. So that's why it might take a little bit longer, but we don't have to wait those 2, 3, 4, 9 days that we had at the very beginning, and which is really great. So we can get people right back to work if we need to. We are not currently doing antibody testing. We aren't actually encouraging that, and the state gives kind of a caution of testing, doing antibody testing at this time because we just still do not have the science behind it to be able to say if your antibody test is positive, it means this. Because we have to say at this point, if your antibody test is positive, it could mean this or this or this.
Yes.
You know, maybe you were infected with a similar coronavirus before. Maybe you did have coronavirus before. Maybe it's a false positive. And we aren't comfortable with not being able to give you an answer for that. So that's pretty much testing, right?
Yep.
PCR, antigen, antibody.
Yeah.
Swab. Okay.
Yeah.
Oh, yay, hearting us ladies. Thanks, Dr. McGurk. When can we use our own cups? Oh, the self-serve cups, maybe?
I think we didn't put any restriction on the cups. We did put a restriction on the self-serve drinks at the very beginning, but those are lifted now.
Mm-hmm.
I would say that is up to whatever convenience store or restaurant you're in. A lot of them you have to take a new cup every time, just like you're at a buffet, because if you put your mouth on the cup and then you put the cup on the thing and get the drink, then your droplet just got on the drink. So the next person that goes and puts their cup on the drink or on the spigot,
The thing, the pushy thing, yes.
then there's the possibility for viral transfer there. And so that's why the not your own cup or get a new cup every time. But we're
not putting restrictions
we didn't
on
put a
that one,
restriction
yes.
on that.
But
so.
that's and we tell you guys these things because we do want everybody to use common sense as well.
Yeah.
So please, if you are going to like a public place where you have self-serve drinks, probably get a new cup every time. Or you know, if your cup is washed or whatever, I guess just be careful because we're still, all of this is really about protecting other people. You know, it's great to protect ourselves, but in the end it's really about protecting other people, which then leads to protecting you because we won't have so much of the virus present in our community. So, all right. Own cups. Let's see. What else do you have on there as far as, I think we need more questions, everybody.
Yeah, come on,
We're getting
guys.
through these well, I don't know, like normal people would get through things. Okay, let's move on.
We're really at it today.
We're really good at this game. Just as far as we know, we have talked about in the past the case fatality rate. That is the calculation of that. And again, we know that we don't, like our numbers cannot possibly be accurate down to the very test or very, person. So from what we know as far as the case fatality rate, where we take the number of deaths attributed to COVID divided by the number of positive COVID tests, then we are seeing numbers in Kansas around 2%. And so in the United States, we're seeing them more in the upper 5%, I believe. And so we do know that this is a significant number. In your average everyday influenza season, we see about 0.1%. And again, we know even in influenza season, we don't know everybody who has the flu. Maybe they didn't come in and get tested. We don't know everybody who died of a flu-related illness. But when we're trying to relay the deadliness of a disease, then these are the numbers that we're able to go by. So we want to make sure that even though we're opening up and we're phasing out, it's still a very serious disease, and that's why we talk about protecting people so much, because there are still vulnerable people out there.
There's a question about what are the state guidelines for hair salons and bringing kids. There's a couple of ways that we could answer that. I don't know the specific state guidelines. I know that the state has sector-specific guidance or like business-specific guidance. I can give you my thoughts on it.
Go for it. Tell us what are your thoughts.
Because my thoughts matter. But no.
They do.
So if you're just taking your kids in to sit while you get your hair cut, it depends on how big the place is, how many people are in there, the whole social distancing thing. If you are taking your children to get their hair cut, it's a little different. My kids are older than Stephanie's, but they're pretty little still. They don't recommend putting masks on a child that's under 2. Mm-hmm. So I would not do that. I would encourage your cosmetologist,
I don't know, hair person. Yep.
to wear a mask if you're cutting a kid's hair that's under 2, just to be safe. Yeah, I think
like anything, if you're gonna go to like Walmart or the grocery store, we're all getting a little stir crazy. So your kids probably want to go. If it's just for fun, like I mean, when you're able to, maybe just you run to the grocery store. You know, the more people we have out and about and touching and sneezing and all this stuff, and again, I don't know if we've stated this before, but kids are kind of gross. They're really gross. And so it's harder to keep their germs off of stuff. So if they can stay home or maybe, you know, not be in a public place, that's fine. But we're not saying like that they can't. We're all, again, everybody wants to just get back to doing what we're doing. Yeah. So again, common sense.
And I took my kids to Walmart, and they've been in the grocery store once or twice. Usually not the whole herd of them, but
she does have a herd.
I do have a herd, but so I don't usually take the whole herd in, but no, I think it's fine. It's fine to get your children's haircut, and if you need to get your haircut and the kids need to go with you, that's fine too. Just do it in the safest way possible.
I just wanted to kind of give a shout out, I guess, for our county as far as the way people have stepped up to help make sure that people had food, you know, because food insecurities, you know, maybe a lot of us don't realize that it's happening, but it happens every single day to people here, to people in the bigger cities, just all over the place. And our county as a whole has been able to provide food through the schools, through blessing boxes, through delivering to homes. That's Fredonia, Neodesha, Buffalo, Altoona. I mean, people are really, really doing a great job making sure that people are not going hungry. And probably still there are issues out there where people don't know where their next meal comes from. But I'm just really impressed with what people come up with.
Yeah.
You know?
Well, and along the same lines, I'm super impressed with how they figure out how to do things.
Yeah.
There's been a lot of that. When we were talking about stay home if you're sick, I was sitting here thinking, really, we've got almost everything figured out so you can stay home when you're sick. There's a lot of working from home. The pharmacy delivers, the grocery store delivers. Most of the restaurants started doing curbside to go. Yeah. Everyone has really come up with a great way, a great workaround, great ways to get people what they need in the safest way possible, and it really is. It really shows. I mean, we've had one case.
And I think that, you know, we know, like in our clinics and in the hospital, that we started doing these telemedicine visits and these phone visits and these curbside visits, and these are things that we're going to continue to offer because they are making sure that people are safe. Like, I have done more than one visit out in the pouring rain, and that's okay because I know the person in the car is safe, and I know that I will eventually be able to change clothes. But we're really doing these things where we're helping each other and meeting people where they are versus, you know, what's more convenient for us as, you know, healthcare workers or as restaurants or whatever else. So it's just been really cool to watch. Like, Diane, thank you for bringing up the summer arts program. They're taking good precautions with the participants and the kids. I think the kids have adapted better than the adults have.
I think so too.
Yeah, they're really good. My kids are always like, but what about the COVID? And I'm like, let's have a talk about the COVID. So, alrighty. Well, we're gonna call for, last call for questions.
Yeah.
If that sounds okay. We want to make sure that everybody is staying safe and taking care of each other. I will tell you that we still have people in our communities that are hurting. You know, people have had high anxiety. There's a lot going on in the world right now, and so if we can reach out, text somebody, call them, maybe drop off some food for them or something, because we really need to take care of each other. It's been a hard time, and it's not just COVID. You know, There's a lot happening in the world. There's lots of protests. There's a lot of anxiety. There's a lot of unrest. There's a lot of politics, and that's just the world we're living in right now. So. Yeah, I mean, just take care of each other. It's a lot for people to handle, and it may be your next door neighbor, and they always have a smiley face on, but in their home where they've been for the last 3 months, they might be hurting. So please check on them.
Yes, absolutely.
Oh, the only other thing I will say is that I believe our schools are doing an amazing job as well. We don't know what the fall is going to look like, and I hear the overarching message is, please let my children go back to school. We get that too. While the alcohol prices are, sales have gone up. No, just kidding. But we know that especially in Wilson County, but really across the state, because we're involved in these, these statewide task forces and things like that. We know that people are really trying hard to come up with the right answer to keep people safe, and that may mean that our schools look different. In the network connection. Nope.
Oh,
there we go.
now.
We're good. So just know that they're working hard to make it safe for your kids, but also make it as doable for your kids too, because we know not everybody thrives with the remote work, not everybody thrives with the in-person work, and so we're trying to do a combination. We've learned a lot through all of this.
We have, and I think our kids have too.
Yeah.
I know I have one kid, and I'm not gonna out that kid. I didn't even use a pronoun.
Oh, good job.
I'm not gonna out that kid. That kid griped about going to school every single day. Hated school, hated school, hated school. And now that kid is
You're
saying,
doing such a good job.
I know, is saying, I just want to go back to school. Like, I don't want to do this online thing anymore. I just want to go back to school. And so maybe that kid and my other kids have better appreciation of
school,
of what teachers do and what.
Yeah, definitely.
They aren't bad people.
I
They
think-
make them do work.
I
That's
think
the
all of
problem.
us parents have better appreciation for what teachers do.
Absolutely.
Yes. Thank you, teachers.
Absolutely.
All right, you guys. Any other questions? We will probably, I'm going to say we're going to do this in 2 weeks. After that, we're gonna see how things go.
We'll evaluate at that time.
We're actually we've been exploring. There are some great shows where people like us just mix drinks online, and we're considering that. Okay, maybe not, but maybe at least 36% chance. So, no, we want to just be helpful, and if this is helpful, that's great. And if it's and if we are past that time, then we will be around and be available for questions. So, anything else you can think of?
I don't think so. We're thinking about doing other helpful little shows after COVID is over.
In the future,
So
yes. We're
gonna-
not sure. If
gonna
you have
get
ideas,
creative.
yes. What do people want to know
about public health.
About public health, yes, and health in general, and it can pertain to Wilson County, or it can be just health in general. So,
So that's your homework assignment.
yes, do it,
Think
people.
of something and let us know what it is, and we'll try and come up with a creative show about it later.
I know. You know us. We will pretty much do anything. That's the thing. On a dare especially. And if there's like $1 involved. That's no more than that, please. We're not promoting gambling. All right, you guys.
All right.
Thank you so much. As always, please be safe. Monday's coming around. Please continue to social distance. Wear masks when it's necessary. Take care of each other.
Stay home when you're sick and wash your hands, please.
Absolutely. All right. Thank you all. Take
Thanks,
care.
everybody.